Hi, I'm Dr. Munshi. In this video, I'll talk about most commonly asked dental questions in different dental job interviews. When I say dental job interviews, that means your state government job interviews, central government job interviews that is related to dentistry when they take dental surgeons. Then different companies they also take dental surgeons like SAIL, HAL, etc. Then AIMS sometimes takes dental surgeons. Then Army, BSF, they also take dental surgeons and they took by interviews. So there are certain pattern of interviews when they recruit dental surgeons. They need a good dentist with good clinical judgment. So how they will test you? They have to ask some questions. They will ask many questions, your introduction, different things, maybe GK, current affairs. But the most important, what I feel in any interviews, I give all type of interviews: state, sale, defense, here and there, different interviews I faced, and I learned a lesson that it requires strong base on your strong base in your subjects, dental subjects and some related medical subjects. So if you have a strong base in dental subjects, other questions doesn't matter. They needs a good dentist with good judgment, sharp judgment. You don't have to be any confusion that you should wear this, you should do this, talk like this. You should have knowledge. This is important. So now just think rationally what type of questions they may ask, how they will judge you. What they expect from you. They expect basic dentistry from you. And when I tell basic dentistry, that means extraction, normal restorations, RCT, that is also day-to-day in practice. Then CD, RPD, FED. FED is so little specialization, but general dentists also do FPDs. Then in periodontics, ultrasonic scaling and your judgment about gingivitis, periodontitis. Now in extraction, what is the most common? Normal extraction procedures, surgical extraction procedures, suture materials, suture techniques. What are the advice you should give after extractions? What are the flap designs? These all things is very common. What are the antibiotics you should give? Or what are the medication you should give? These things are most commonly asked. Next, when I tell about extraction, one chapter is parallelly goes with extraction, that is local anesthesia. You should have 100% thorough knowledge about local anesthesia. Read the topic from Malament. This is a very good book. The mechanism of actions, type of local anesthesias, then systemic actions, local actions, systemic side effects, local side effects. These all things you should have a thorough knowledge, local anesthesia. So in oral surgery, first read extraction, then read local anesthesia. Then go to the conservative dentistry and endo. What I am not saying that all the other chapters like space infection, fractures, you have to read also. You have to read all the things. But first finish these common things. So next, conservative, types of cavities, types of tooth preparations, what are the bar required, then what are the common filling materials. You should have knowledge about amalgam, composite, JIC, zinc oxidizonal, zinc phosphate. These things you have to have thorough knowledge. Then RCT, in RCT, access opening, BMP, different types of BMP, different types of obturation, obturating materials, and in the chapter of BMP, irrigating solutions, intracanal medicaments. These all things are very much important. After completing these things, you have to read in depth other chapters also. But for basic dentistry, this much knowledge is enough. After that, in periodontics, gingivitis and periodontitis, read its types, clinical features, treatment. So after finishing these common topics, read medical emergencies, that is related to dentistry, syncope, anaphylaxis, status asthmaticus, status epilepticus. These things you have to read. Next, what you have to read? Different medical conditions, and when a patient presents with these conditions, how to treat. A patient comes to you with diabetes, so how to manage this condition. Patient comes to you, patient is asthmatics, patient is asthma patients, so how to treat these patients. Patient is a known patient of epilepsy, so what are the precautions you have to take. Patient is a cardiac patient, and patient took aspirin, then patient may took warfarin, patient different medication patient is taking. So what are the blood investigations you should do? So these things you have to read. You have to know these things, but because you have to manage patients. So after completing all these things, read other chapters of different subjects, like in oral surgery, fractures, your maxillary sinus, then space infection, then in endo other chapters, apexogenesis, apexification, pulp capping, other subjects, other chapters is also important. In periodontics, surgical part and other different acute gingival conditions like this. Oral pathology also, the read the developmental anomalies part, then read different oral manifestation of systemic diseases, skin diseases, the important things that you read for your final year, not final year, third year. These things do not go in detail of various diseases, just read the clinical features and treatment. Clinical features and treatment. You don't need to histopathology, etc. If you can cover this much amount, that is good for your upcoming interview, and I wish you all the best for any interview what you are preparing. Thank you very much.